at different points in time. I can tell you that with gastric bypass, up to 80% of patients will resolve their diabetes initially. If we look at lap band, your average resolution is going to be lower. It's going to be probably 50 to 60%. And part of that is because you're relying totally on the weight loss to resolve the diabetes. And, well, I would say totally on the weight loss and dietary changes, because dietary changes definitely have some impact on it. The surgery that has the highest resolution of diabetes is without question duodenal switch with greater than 90% resolution. And so, again, we get back to sort of the less invasive or a little bit less effective, and the more invasive or a little bit more effective. You know, we want to try to, you know, cut the carbs as much as we can. I mean, it's not that we do something totally different than non-surgical treatment. It's just that if we do some of the similar things that you've tried, you know, maybe in diets and things like that, and then we add the surgery to it, that it'll just be more, it'll be more effective, and it'll work better. Okay, so we do still need to watch carbohydrate intake. We need to watch fat intake in most cases. We make sure you get enough protein in. We're going to try to teach you about foods that might give you trouble with your restrictive surgery. You know, what's likely to stay down and what may come back up. So there are a lot of things like that we just try to give you some guidelines that will help you get through your surgery, be successful, and not have a lot of problems. So there are a lot of things that can go into that decision about surgery. You know, your lifestyle, what kind of results you're looking for. Have you had a prior surgery on your stomach or anything like that? That certainly could modify your decision. You know, medical conditions like diabetes or other medical conditions that may come into play in the decision. Ultimately, you have to be comfortable with whatever we're going to do. And so I don't want to try to talk you into something that's more invasive than you're comfortable with. And I think that's important. And as we've touched on, you know, earlier, insurance coverage and the cost of the procedures, if you're paying out of pocket, can also play a role. I do have a lot of women that are in the childbearing years, and so we generally make a point of it that this is not a bariatric surgery and pregnancy don't go together, at least at the same time, okay? Because they have kind of opposing goals, if you will, and you'll make your obstetrician really, really nervous if you have a gastric bypass and then you get pregnant right afterwards, because it's going to be very hard for you to gain weight. In fact, it's going to be very hard for you not to lose weight. And so we just tell our patients, if you'll wait until your weight is stable, then it's fine. And so I think that, you know, people have concerns about invasive surgeries, malabsorption, and what happens. And I think there's a lot of evidence to say that we can do these surgeries and people can still be very healthy and have normal pregnancies and things like that.
Hi, my name's Alma. I had lap band surgery almost a year ago, and I've lost 101 pounds. Prior to my surgery, I was borderline diabetic. I had hypertension that was getting progressively worse. I also was having a lot of joint problems, especially my knees and hips, and that's all been resolved since the weight loss. I had a lot of trouble getting around, especially climbing stairs, that sort of thing. I was very short-winded and just out of breath a lot and very low energy. Yes, I definitely would do this again, and my advice would be anyone who is morbidly obese to go see their doctor, particularly Dr. Stewart. My advice, anybody who does choose to do this, is to follow their program explicitly. I think that's the key to the success that I've had, doing exactly as they told me.
Anyway, my name is Cindy, and I had lap band surgery 16 months ago, and I have lost 108 pounds so far. And it has really changed my life. I'm much more active than I used to be. I feel so much better. I have much more energy. I can do all the things that my kids always wanted to do. And I mean, I feel so much better. My husband could put his arms around me now, and life is just great. Being a fat person that I was, I mean, you do obsess about food. I mean, it's hard. It's hard to go on a diet and try to restrict the amount of food that I could eat, because yeah, it's all you think about is when do I get to eat again? When do I get to eat again? So the lap band has gotten me past that, so that I can now eat everything that I want to. Like they've always told us in the beginning, it was never a diet. It's just a change in how much that you can eat, so it can help me get past that, because I was never able to do that before on my own. So now this does help me limit the amount that I can get in a nice, healthy way. I try to eat better, try to do what they tell me to do, and have more meat, less carbs and things like that, eat more vegetables. So I do try to eat a lot better than I used to, but it does help me to maintain those portions that I need, and also makes me feel full longer, so that I'm not hungry all day long. I work from home on a computer all day long because my company's in Florida, and I mean, I could just snack all day long because there wasn't anything else to do. I mean, you know, you eat when you're bored. So now I don't have that need anymore because I'm not hungry all day long. So it really has helped with that.
Okay, my name's Christina, and I had the Roux-en-Y procedure about 6 years ago, and I've lost a little over 125 pounds. I used to work in the apartment industry, and I was required to walk flights of stairs, and being that heavy, over 250 pounds, by the time you got to the third flight of stairs to tour an apartment, it was pretty hard to talk, much let alone breathe at that point. So once I had the surgery, I really saw a huge difference there with being able to move and walk and breathe. And I didn't really realize, I don't think, how miserable I was before. It never really hit me. Yeah, and I saw those huge changes just 6 months after surgery. I would tell them that it's a huge commitment, and it's a lifelong commitment, and it's a tool, and you have to make a choice of whether you want to use that tool. But I would definitely do it again, and I would recommend that, you know, if it's the right choice for you, then to definitely look into it.
I'm Terry. I had my surgery not quite a year. I had the duodenal switch, and I've lost 153 pounds so far. Before surgery, I had sleep apnea was my main problem. I also had a condition called sarcoidosis, which affects the lungs. I was short of breath. I had trouble breathing. I had 2 small children that it was very hard to keep up with. I really wanted to improve my quality of life for them, to be around for them. I'm a single parent, and so it was hard to consider weight loss surgery, wondering, you know, how it would affect my family if something happened and the complications. But I'm a registered nurse, and I felt it was important to do something proactive to be there for the long term for them. There have been many positive aspects regarding this surgery. For the first time, I understand what it feels like to be full. Before, I would just eat and eat, and it was a way of coping. And now physically, I can only eat so much, and I have to stop. And I realized how much I was really overeating, and basically medicating myself with food, and it was a way of stress management for me. If I had a bad day or something was going on in my life, I would turn to food, and that was my coping. And now I might go for a walk, I might do some retail therapy, but it would be like at a thrift store or something like that, not to an extreme, or spend some time with the kids and do other activities. The good part is I'm really more focused on my nutrition and making sure that I get my protein in, and having more of a well-balanced diet. With the surgery, I'm forced to think about those things, whereas before, if it was just doing a diet and that type of thing, you could always maneuver around it and find ways to sneak things in. But it's very important to realize that you have to, for the rest of your life, watch your protein, watch your vitamin intake, and you have to realize that this is a life-changing thing, but you have to be responsible and be ready to do all those things when you make that decision.
My name is Stephanie, and I had the duodenal switch about a year ago. I've lost 156 pounds. About 6 years ago, I was diagnosed with PCOS, polycystic ovarian syndrome, and part of that is insulin resistance, which mimics type 2 diabetes, and I had blood sugar issues like type 2 diabetes. I also experienced an increase in my blood pressure. My average blood pressure on medication was about 170/100. That was about as low as I could get it. And I was also having issues with sleeping, with sleep apnea. Being able to walk down the street a block was almost impossible for me. I would have to stop and rest and catch my breath. Walking upstairs was nearly impossible. I have 3 children, and so the idea that there was a very real possibility that I wouldn't get to see them grow up really hit home for me. And so I decided to look into weight loss surgery after years and years of dieting and losing weight, gaining it all back, and just adding insult to injury on my health issues. Well, before I left the hospital, my blood sugar issues had already resolved themselves. I went from a resting glucose level of about 120 to a resting glucose level of 79. My blood pressure had already resolved itself. Like I said previously, my blood pressure was about 170/100. Before I left the hospital, it was about 115/70, and today it's about 105/62 is what I normally run, without any medication at all. I now can easily walk 4.5, 5 miles. I engage in weight training about 3 times a week and cardio training another 2 to 3 times a week. I just have energy that I couldn't even possibly dream of before. I joke all the time that Dr. Stewart not only gave me my life back, but he gave me the life I always wanted that I never even thought I could ever experience.
My name's Haley. I had the duodenal switch. I had it almost 3 years ago. I lost 170 by 1 year, 202 pounds by 22 months. I started at 349 and I got down to 142. I went from a size 3X shirt, 24 pant, to a small, medium shirt and size 4 jean. Before my surgery, I tried many diets. Nothing seemed to work, and if I did lose, I would regain. And it seemed like a constant struggle, and I got to the point where I was morbidly obese to where the amount of weight I needed to lose, I knew I did not have the willpower to diet for as long as it was going to take, especially when I can diet for 4 months and only lose maybe 5 or 6 pounds. I needed to do something that was going to physically stop me from overeating, stop me, because that was my problem. I was a binge eater. Before I had surgery, I didn't think I ate a lot, but after having surgery, it opened my eyes to just how massive I was eating. I was eating for any reason. I was eating for comfort. I was eating because I was happy, because I was sad, because I was bored, because it's 5 o'clock and that's dinner time. So I needed to change the way I looked at food. I needed to change the way I felt about food, and the surgery helped me on the way.
Hi, my name's John. I've lost 243 pounds. I had the duodenal switch about 10 months ago. I had high blood pressure, I had diabetes, I had joint pain, I had lower back pain, just all around not good shape. And now I basically don't have any of that. I do take a blood pressure medication just for maintenance, but he says I'm gonna be off that in 6 months. So life's changes. It's one of the best things I've done. I can't stop saying that. But, you know, I did it for my kids because they needed a dad to grow up with, so had to do it. We walk. You know, before it struggled to walk to my truck. Now we walk around the block. We go hunting, walking through the woods, just riding bicycles. You know, I couldn't do any of that stuff. You know, we go to the beach and go swimming. You know, it's just great. Don't wait, do it as soon as you can. It's good. When I started, I was 530 pounds, and down to 240 or 289, and it's, you know, he's a godsend if you ask me. He's helped me out a great deal.
My name's Ken. I had a Roux-en-Y gastric bypass about 9 months ago, and I've lost 132 pounds. Yeah, before my surgery, yeah, I had a hard time getting around playing with my kids. I have 2 little ones, and since then I've got to enjoy the time with my children a lot more. My health conditions before the surgery, my blood pressure was a little high. I was borderline diabetic, and that's all gone away. So I'm blessed. Since the surgery, I've lost a lot of the appetite that I used to have. I couldn't control what I ate. Now I'm satisfied with just a little food. Dr. Stewart and his crew, they've been awesome. You know, I was a little uneasy at first, but they made me feel really comfortable. They've stood beside me the whole way through the procedure, and it's something that I'm glad that I did, and I would definitely do it again.
Hi, my name is Gareth. I had Roux-en-Y gastric bypass 13 months ago. My total weight loss to date is 120 pounds. Before I had the surgery, I suffered with type 2 diabetes. I had very high blood pressure. I'm a soccer coach and a referee, and I had trouble with knee joints and just basic pain from even laying down or exercise or whatever. Since the surgery, I am now not diabetic. My blood pressure runs at around 110/60 each time I have it checked. So all the medical problems seem to have gone away. I get over things like colds a lot better, a lot quicker. I don't pick up silly illnesses that I used to pick up. I obviously don't take any medication apart from the occasional headache medication, Tylenol or ibuprofen. My life now is completely different. I've been overweight since I was 9 years old. I weigh lighter now than I did at 12. I'm fitter now at 50 than I ever was as a teenager. Life is just so much better. This is probably the best decision I've ever made to have this surgery. I had spent all my life struggling with weight, and anybody else that suffered the way I have with overweight and all the other things that go associated with it, this is probably the best thing you could do. Maybe not the same surgery that I had, and I would categorically recommend this to do this surgery. So if you're contemplating it, you really need to do this surgery.
My name is Sue. I had the Roux-en-Y bypass about 13 months ago, and I've lost 84 pounds. I didn't have any problems, as in, you know, I didn't have high blood pressure or diabetes or nothing. I was just tired. I was just lethargic. I couldn't walk. I mean, I noticed, like, going to my son's soccer games, just walking from the car to the field, I was worn out because I wasn't used to carrying as much weight as I was carrying, and it just made me feel like I didn't want to leave the house. I just wanted to be home. I didn't want anybody to see me. I just felt miserable. I certainly got more energy. I certainly want to get out and about more. And I just feel better. I feel better about myself, and I would, you know, anybody that's sitting on the sideline wondering, I would definitely recommend that you go and and look into it.
Hello, I'm Bianca. I had the sleeve gastrectomy performed 3 months ago and I've lost 48 pounds. Before my surgery, I didn't have any health problems or anything like that, but I just wanted to get my foot in the door and go ahead and have the surgery. My mom had gastric bypass performed by Dr. Stewart 6 years ago, and I saw her amazing results and knew that the way that I was going, the weight that I was putting on, I really needed to, go ahead and get the surgery done. And I've had amazing results, and Dr. Stewart's amazing. If anyone was thinking about this surgery, I would tell them, this was one of my best decisions I've ever made in my life, and so many more doors have opened, even though people say, losing weight, or you don't have to be, or if you're fat, you can't do this or that, that's nothing like that, but I have just so many more doors have opened now, being skinny. I have so much energy to live my life, and it was a great decision. I'm only 22, but I really wouldn't go back and do it any different.
My name is Mike. I had the gastric sleeve surgery approximately 10 months ago. I've lost around 155 pounds so far, still losing and feeling better. Well, some of the, problems I had were, bad knees, shortness of breath sometimes, when working out. Also have a little girl, just turned 2, and wanted to be more healthy for her so I can play with her and be around for her. Those were the main issues that I was, and of course looking better. That's definitely a positive now. Since I've had surgery, knee pain is gone. Change in diet, I'm eating a lot more fruit. It's weird, I'm eating things that I used to not like fruit and things, vegetables, things of that nature. Kind of off soft drinks altogether. Overall diet is improved by far, and just feeling better and better every day, honestly. So, and I would say absolutely, I would do it over again every time. Yes, sir.
My name is Donna, and I've had lap band surgery, and I've lost 100 pounds, and it is something I enjoyed. There's no regrets of having done that. Yes, I had a lot of health issues. I was on high blood pressure medication. It was very difficult for me to walk and get around. It was to the point where almost, when you go to Walmart or a place like that, of getting the motorized cart to walk around, it was just very difficult to get up and maneuver or do any kind of anything, just to walk or function, and just to get up out of my chair and go to the bathroom. It's just to walk and get dressed, and being as short as I am, it's like it was just, that's a lot of weight to carry around on a 5-foot short body. I don't say tall because you're not. So, and that was a struggle to carry around that kind of weight. And I'm going off high blood pressure medication, and I was just fortunate enough that I didn't get it like diabetes or any of the other health issues that come along with being overweight. I would say if you can do the surgery, if you're thinking about doing this surgery, this is something I have not regretted doing. I have, been struggling with my weight all my adult life, and I would do this again in a New York second. I would do it all again.
Hi, I'm Kathy. I had D-switch 3 years ago. I've lost almost 200 pounds, and my life has changed so dramatically that I never thought I'd be here today. 12 years ago, I was told that I would never get pregnant. If I did, I'd never carry to term. It was almost an impossibility with the weight that I carried and the hormonal difficulties and problems that I had just from being overweight. After surgery, I got the best surprise of my life. October of last year, we found out we were pregnant, and it was just amazing. I have a 4-month-old that has changed my life. Now I have a family that I never would have had if I hadn't had the surgery. I'm ecstatic and can keep up with him. I'm looking forward to being able to run after him, taking him to the zoo. 4 months after surgery, we went with friends to the zoo. And for the first time in my adult life, I walked through the zoo without having to stop every 5 minutes and asking everybody to wait on me. I was with the kids in the group going, look, 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 let's go over here, let's go over here. It was just a wonderful experience. And now I'm going to get to have that experience with my own child. If somebody were to ask me today, should I do this? My answer is go see Dr. Stewart, sit down, go through everything with him. There's different ways for different people to lose weight. You don't have to be trapped by your body anymore. There's a life out there to be lived. There's a life out there that you may not know is coming. You know, I've got the family that I was told 12 years ago I'd never have. My future is so much brighter than it was before. I just can't wait. This is what I wore the morning I went to the hospital to have surgery. This is not something I ever planned to be back in, ever. This changed my life.